Hi, I am Dr. Ranjith from the Department of Periodontics and Implantology. Today I am going to discuss the topic which is role of neutrophils in periodontics. So in this video we are going to discuss about introduction of mechanism of inflammation, introduction to neutrophils, development and structure of neutrophils and fate of the neutrophils, neutrophils homeostasis, functions, transendothelial migration, phagocytosis and neutrophils extracellular trap, neutrophil defects, qualitative disorders of neutrophils, role of PMN in periodontitis, and microbial target to subvert the immune response and conclusion. First we will see what is inflammation. Inflammation is body's defense response against an infection or a pathology or even a trauma. So what happens in inflammation? Inflammation is of two types, which is called acute inflammation and chronic inflammation. Mainly in acute inflammation, you will see a vascular changes. What vascular changes you see in acute inflammation? Mainly you will have vasodilation effect, where the vessels will be vasodilated and increase the vascular permeability. You have to ask a question, why in acute inflammation there is a vasodilation as well as vascular permeability? Because to the infection site or injury site, you should have a blood vessels moving towards, increase the blood flow towards the infection site. So for main reason there is a vasodilation and the vascular permeability. Through this vasodilation and vascular permeability, the neutrophils from the blood vessels reaches towards the endothelium. From the endothelium it reaches the connective tissue and reaches the site of infection or injury to reduce the infection as well as injury. So this is the main aim of acute inflammation. So in gist or in summary, if anyone asks what is acute inflammation is nothing but immediate body's response against the infection or injury to reduce the multiplication of the bacteria or to reduce the damage happening to the host tissue. So this is the acute inflammation. So if anyone asks you what is acute inflammation, you have to know two important key points, which is called acute inflammation is body's immediate response to the infection or injury. So mainly what is acute inflammation is that it has vasodilation effect will be there, as well as increased vascular permeability and cellular events. What cellular events happens in the acute inflammation is that first line of defense cells, which is called neutrophils, will come to the site of injury or the infection to get rid of the infection as well as injury also. So this is the main gist of acute inflammation. So next we will move into introduction. What is neutrophils? From the name itself, neutrophils, that means neutral staining, which loves a neutral staining. Okay, that is called neutrophils. Neutrophils means what? Which loves the neutral staining. And another important thing you have to know in neutrophil is that it is an innate immunity and it has a non-specific mechanism. What is this non-specific mechanism? Non-specific mechanism is nothing but it doesn't have any memories like B cells, T cells. Whenever the infection comes, the neutrophils go and kill the infections. It doesn't keep any memories. So that is the reason it is called innate immunity as well as a non-specific immunity. And the third thing is that it is a first line of defense. Wherever the infection or injury happens, the first cells to go and kill or to reduce the bacterial count, it is neutrophil. So in introduction you have to know a main important thing, which is neutrophil is a first line of defense as well as it is a non-specific and immediate response to the injury or the infection site. So next we will move into development of neutrophils. So how this neutrophils develop? Okay, mainly the neutrophils will develop from the bone marrow. Okay, so bone marrow has a stem cells which is called hematopoietic stem cells. What is this hematopoietic stem cell? From the name itself, hematopoietic. Okay, Hemato means where it is going to give a blood cells. Okay, it has a multipotency. What is this multipotency? Means it can give rise to different lineage of cells, that is called multipotency. So either it can give rise to a neutrophils or B cells, T cells, or even a monocytes or macrophage. So it can give a variety of multipotency cells. So the name called multipotency hematopoietic stem cells. So after the bone marrow produces the hematopoietic stem cells, it is divided into common myeloid progenitor and common lymphoid progenitor. What is this myeloid progenitor and lymphoid progenitor? So the main thing you have to know in lymphoid and myeloid, from the name itself, myeloid means as resemble as bone marrow tissue. Okay, so you have to know that myeloid means bone marrow tissue, whereas lymphoid progenitor means from the lymph nodes it's coming. So it's like a lymphoid tissue which is going to give the derivative of B cells and T cells. So from the common myeloid progenitor, the neutrophils will get its origin, okay, which is from the common myeloid progenitor. It gets into myeloblast and it converts and differentiates into neutrophils. So from this slide or from this gist, you have to know the main key point is that the neutrophils are derived from the bone marrow with the help of hematopoietic stem cells, and after the hematopoietic stem cells, it gives its origin through common myeloid progenitor cells. Okay, from the myeloid progenitor cells, it differentiate into myeloblast, and this myeloblast will be differentiated into neutrophils. So this is the development of neutrophils. So next we'll move into structures of neutrophils. So it's a very important thing to know the structures of neutrophils, because the main structure of neutrophil is that it has a multi-lobe nucleus. So only the name came polymorphonuclear neutrophils, where polymorphonucleus, where it has multi-lobe nucleus. So you have to ask a question, what is this advantage of multi-lobe nucleus? So the main advantage of this multi-lobe nucleus is that, okay, it increases the elasticity of the neutrophils. Okay, since the neutrophils has a multi-lobe in it, it increases the elasticity of the neutrophils. Why this elasticity has to be increased? The main thing is that from the blood vessels, it has to reach to the endothelium, and to the injury site it has to go. So if it is not having elasticity, means it cannot able to travel from the blood vessel to the site of injury. So only the structure itself provided the neutrophils to increase the elasticity by providing polymorphonucleus. So next, the major important structure in the neutrophil is that it has sparse mitochondria as well as Golgi apparatus, whereas it consists of only a limited rough endoplasmic reticulum, or sometimes even it is being absent. Why the rough endoplasmic reticulum is absent in the neutrophils? So the main thing is that neutrophils main function is that immediate response to the site of injury or the disease site. So it does not involve in protein synthesis. The main aim of rough endoplasmic reticulum, or main function of rough endoplasmic reticulum, is to provide a protein synthesis. But this neutrophil does not need a protein synthesis, because its main aim is first line of defense to the injury site or even to the infection site. So neutrophil does not need rough endoplasmic reticulum. And another important structure in neutrophil to compensate rough endoplasmic reticulum, it needs a abundant cytoplasm with secretory vesicles and granules. Why the secretory vesicles and granules are more important in neutrophil? Because there only all the antimicrobial peptides, antimicrobial activities happens. Okay, so there only a killing mechanism happen. So only in neutrophils, the very important structure is abundant cytoplasm with secretory vesicles as well as granules. So what is this secretory vesicles? From the name itself, vesicles means a transport. Okay, it is a transport from it will transport the material inside the cell to outside the cell, or it receives the material outside to inside. So it's like a transport. Where it is present? It is always present on the membrane bond. What is this membrane bond? Membrane bond is nothing but these secretory vesicles is bounded over the area or around the area of the plasma membrane. So only the name came, it is a plasma membrane bounded. So what is the function of this vesicle? I already told. The main function of this vesicle is for transport. Okay, and what is this granules? Neutrophils mainly composed of 3 granules in it, which is called primary granule, otherwise it is also called acidophilic granules. The second thing is that secondary granules, or it is also called specific granules. Third important thing is that tertiary or gelatinase based granules. So we'll discuss more about primary, secondary and tertiary. So what is this primary? The primary, the other name is also called, which is acidophilic granules. The main function of this acidophilic granule is to internalize the bacteria. So what is this internalization of bacteria? So since this neutrophil will go and engulf the bacteria, okay, it will engulf the bacteria and ingest the bacteria. After engulfing, it takes the bacteria inside it and it starts killing it with the help of this acidophilic granules, which is a primary granules. The example of this acidophilic granule is myeloperoxidase, okay, which increases the reactive oxygen species. What is this reactive oxygen species? Reactive oxygen species is nothing but loss of electron where the oxygen is in unpaired state. So it will give a destruction by destructing the bacterial cell wall. So this is the main aim of primary granules. So the secondary granules is also called a specific granules. So what is the main function of this specific granules? The main function of this specific granule is to provide or to stabilize a immune response. It is modulating the immune response in an equilibrium state. The third thing is that tertiary granules or gelatinase based granules. So what is this gelatinase based granules? Why it is important? Because the neutrophils has to travel from blood vessels to the endothelium towards the site of injury. Tertiary granules. So what is the function of tertiary granules? Since the neutrophils has to travel from blood vessels towards the endothelium and reaches the tissue, which is either a site of injury. So during that time, the neutrophil has to cross a connective tissue. So the connective tissue consists of a lot of collagen fibers in it. So it is very difficult for the neutrophils to travel easily. So with the help of this tertiary granules, which is also called gelatinase based granules, which is going to release MMP. What is this MMPs? Matrix metalloproteinases, which is from the name itself, proteinases, it's going to break. What it's going to break? It's going to break a collagen, because the major content of the connective tissue is collagen. So only it is very difficult for the neutrophils to travel because a coarse fibers content in it. So with the help of this tertiary granules, it will release matrix metalloproteinases. This matrix metalloproteinases will break the collagen fibers with the help of collagenase. So this paves the way for the neutrophils to easy travel to the site of injury or infection site also. So the end of this, we have to know a certain important key points about the granules. Mainly the key points for primary granule is also called acidophilic granules. The main function of this primary granule is to produce reactive oxygen species and to kill the bacteria with the help of myeloperoxidase. The second important thing is that secondary granules, it is always useful for maintenance of immune response. The third thing, it's a tertiary granules. The neutrophils as a difficult in traveling towards the connective tissue because the connective tissue consists of lot of collagen fibers in it. So the neutrophils has to release these tertiary granules with the help of matrix metalloproteinases. The collagenase activity happens. There will be a connective tissue breakdown. This paves the way for the neutrophils to move freely towards the site of injury or the infection. So next we'll move into what are the receptors present in the neutrophils. The main important receptors present in the neutrophils are FCR. What is this FCR? Fragment crystallizability receptors. So these receptors has been present, as well as VAMP receptors. What is this VAMP? Okay, vesicle adherence membrane receptors. Okay, so VAMP is a vesicle adherent membrane receptors, as well as you will have a complement receptors also, like C3A receptors, C5A receptors. Why this receptors is very important, especially the complement receptors? After neutrophils comes out of the blood vessels, the neutrophils has to travel towards the site of injury. So it cannot go into other site. For example, neutrophil has to know where the site of injury is happening. So this complement will coat the bacteria with the opsonization, which is called opsonization. So by knowing this, the neutrophils is able to go to the site of injury or infection. So only this C3A and C5A receptors is present in the neutrophils. So the receptors mainly for the neutrophil is to receive the signals. So the main function of receptor is that to receive the signal, and it causes a transduction. What is this transduction? Once the receptors receive the signal from other cells or from the bacteria, it will transduct, or it will inform the neutrophils that the signal has been came. You have to go to the site of injury. So only the receptors is needed. Okay, from this end of this receptors discussion, you have to know a single key point, that receptor is mainly important for receiving the signal and intimate the neutrophils that you are in need for the infection to get rid of it. So this is the importance of this receptors. So next, fate of neutrophils. What is the fate of neutrophils? Okay, the neutrophils is mainly present 1 to 2 days. So the neutrophils is a short lifespan activity for just for 1 to 2 days. And another important thing in this fate of neutrophil is that in circulation the neutrophil stays for around 4 to 6 hours, whereas in periodontitis or other any chronic inflammation stage, the neutrophils will have a reprogrammed phenotype activity. What is this neutrophils reprogrammed activity? So normally the neutrophil will stay for 1 to 2 days, or in circulation it is around for 4 to 6 hours, whereas in chronic inflammation there will be more clumping of bacteria. This leads to more neutrophils comes to the site of infection or injury. So this causes a chronic inflammatory response. This leads to clumping of neutrophils, where the neutrophils clearance is delayed. Okay, the neutrophil clearance is delayed, which leads to again increase the chronic inflammation. Okay, so in chronic inflammation, the neutrophils are reprogrammed phenotypically to stay for a long period of time because the clearance activity is delayed. So once the clearance activity is delayed, automatically the neutrophils will stay for a long time and there will be a prolonged inflammatory state is happening. So this is the fate of neutrophils. The main fate of neutrophils is that short lifespan for 1 to 2 days, as well as in circulation it's around 4 to 6 hours, whereas in a disease state like chronic inflammation, it is reprogrammed phenotypically and it stays for a long duration time, and that leads to more inflammation. So this is the fate of neutrophils.